accessible remotely, please join the meeting from your computer, tablet, or smartphone. You can also watch this meeting on YouTube through the City Council. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and his order imposing strict limitations on the number of people. Can you all see me?
Solo escuchar.
Okay.
I cannot see you.
Okay, no sé qué está pasando aquí. Share my webcam. Ahí está. Okay. Imposing strict limitations on the number of people that may gather in one place. This public meeting of the City of Lawrence's local Board of Health is being conducted via remote participation. At this time, no in-person attendance of members of the public will be permitted, but the public can listen and view this meeting while in progress by visiting our website. Members of the public attending this virtual meeting will also be allowed to make comments if they wish during the portion of the hearing designated for public participation. They can also respond via phone or video by typing a message to the members of the board or city staff. So roll call. Dr. Joel Gorn, that's me. I'm present. Stephen Hill?
Present.
Wonderful. We'd like to, is there a motion on the floor to accept the minutes from the meeting dated March, what was the dates, Felix? It says March 67. March 17th? Probably March 17th, 2021. Stephen?
Can I have a motion to accept the minutes for March 17th?
Okay, all in favor? Aye. Okay, public comments and participation. Is there anybody who would like to make a public comment or participate with a question? Okay, what I would like to do for this meeting is we're going to jump straight to new business for Alex Babilonia, Mayalin Baez, Leandro Ferreras Castillo, Alejandro Ferreras Castillo, Elizabeth Almonte, regarding microblading in the city of Lawrence. They're all applying for a license to perform microblading in the city of Lawrence. So right now, the city of Lawrence does not have any guidelines or rules and regulations that govern microblading in the city. The board members are even a little unclear on what microblading is. So we know this is a widespread practice in aesthetics. And so at this point in time, I believe what we are going to do for both Alex, Mayalin, Leandro, Alejandro, Elizabeth, we are going to give you all a provisional license to practice microblading with the caveat that we are going to ratify these licenses at a further Board of Health meeting once we set the rules and regulations and guidelines for microblading in the city of Lawrence. So, si quieres que te diga en español, te digo en español. Microblading es una cosa, bueno, no tan nuevo en el mundo, pero un poquito nuevo en Lawrence. Entonces, en este momento no tenemos regulations ni guidelines que gobierna el acto de microblading. Sabemos que es una parte importante del mundo estética. Entonces, pero este momento vamos a ofrecer una licencia provisional para practicar microblading en la ciudad de Lawrence, mientras nosotros desarrollamos unas reglas, normas y guidelines para gobernar este mismo servicio que se están ofreciendo. En el futuro vamos a ratify, no sé ni la palabra en español, vamos a ratify las licencias que vamos a ofrecer adelante. ¿Entendiste, Elizabeth? ¿Cuál es la palabra?
Rectificar.
Rectificar, exactamente. Muy bien. Entonces, para aquí en adelante, Mike Armano, nuestro agent to the board, va va a entregar licencias provisionales a todos para comenzar tu negocio. Y en el futuro vamos a poner adelante las normas, reglas y los prerequisitos que esperamos que ustedes pueden ofrecer a nosotros para rectificar o ratify las licencias y cambiar las licencias provisionales a licencias fijos. ¿Está bien? Okay. Stephen, can I have a motion on the floor to offer a provisional license to these 5 members that are looking to provide microblading as we pursue regulations similar to the city of Boston?
Okay, I would like to make a motion to give them a temporary license until literature or clarity is set up, to give a provisional license until the rules are set. So,
Muy bien.
to 5 individuals. I'm sorry, I don't have any paperwork in front of me. So,
okay.
So,
I second that motion. And so, mira, una cosa más. De ustedes 5, el que habla español, no, el que habla inglés, por favor nos explica al público cuál es el proceso de microblading y cuál típicamente es el entrenamiento de ustedes.
Yo lo puedo explicar en español completo.
Ok, explica en español y yo lo voy traduciendo.
Ok, el microblading es una técnica que crea perfección. Ahora mismo hay muchas variantes y muchas técnicas diferentes que todos los que estamos aquí, muchos que nos conocemos y muchos no, pero trabajamos diferentes técnicas. Lo que hace es perfeccionar el arco del ojo y crear perfección en las miradas. Son procesos estéticos, es proceso estético, se hacen semipermanentes y crea de verdad que está bien en el ámbito de la belleza ahora mismo y muchas personas requieren el servicio.
Okay, espera un momento. So this is an aesthetic process to manipulate the arch of the eye, particularly the eyebrow, semi-permanent that many people are looking for in the community. This is common practice in salons and so una cosa más. What is the training that you guys offer? Where do you learn to do microblading?
El microblading hay muchos adiestramientos y cursos que se hacen como educación continua. La mayoría de las personas que trabajan microblading son especialistas en belleza o esteticistas. Yo considero que también tenemos un poquito de conocimiento de lo que es procesos médicos de enfermería, como el manejo de fluidos y limpieza, esterilización, proceso de cuidado, de sanado, y tienen que ir a la par con varios training. Ahora mismo, los requisitos, ya tenía licencia anteriormente en la ciudad de Lawrence y tuve que coger Bloodborne, que eso es como trabajar con fluidos.
Okay. All 5, un momento, por favor. All 5 of you have basic training how to handle body fluids and understand bloodborne illnesses. Todos tienen el entrenamiento básico en manejo.
Sí, yo tuve que hacerlo también porque yo tenía licencia anteriormente de aquí de la ciudad.
Sí.
Y fue uno de los requisitos.
Okay.
My understanding, Dr. Gorn, is this education is actually given in a lot of beauty schools. My information that I read, they consider it's almost the same category as tattooing, permanent makeup. But there are courses of anatomy and physiology given in 90% of other beauty schools in regards to microblading.
Excellent. Okay, perfecto. So ustedes 5, all 5 of you, tiene la licencia provisional. You can acquire that from Mike Armano in Inspectional Services. And if we have any further questions going further, we will notify you. Muchísimas gracias y espero que todos tengan éxito. I hope you all are very successful.
Buena
Una
suerte.
pregunta. Esa licencia temporal provisional, ¿qué tiempo va a durarnos?
Bueno,
¿Cómo se
hasta
va a
que te
informar que ya
diga,
va a
hasta
existir
que
una
te
nueva?
diga, probablemente vamos a poner las normas en la próxima reunión y de ahí en adelante pueden entregar los papeles que ustedes tienen de su educación y vamos a cambiar la licencia profesional a uno permanente, pero no en una reunión del salud pública. Vamos a hacerlo en la oficina de Inspectional Services, just like we do other permits, ¿ok?
Ok.
Ok, muy bien. Pues tengan éxito. Gracias.
Éxito a todos, compañeros.
Una pregunta.
Dime.
Y una pregunta. ¿Y qué certifica? O sea, ¿es un permiso de palabra o nos van a entregar un certificado?
No, te van a entregar algo, They're going to give you a license, a paper license that you'll get from the Board of Health that'll say provisional license. And it probably will have a beginning date and an end date, but we'll make sure that those licenses get transferred to all licenses in Lawrence you have to pay for and apply for every year. So these will be provisional licenses and they will be converted to vamos a convertirlo en una licencia a lo largo plazo, pero en toda la licencia de Lawrence hay que aplicar todos los años y pagar un gasto mínimo.
¿Debemos de ir a buscar mañana a City Hall o cuándo?
Ok, mira, ponte en contacto con Mike Armano mañana y te va a explicar todo, ¿ok?
Ok.
Ok, excelente. No te preocupes. Estamos aquí para apoyarte. We're here to support you, not to make it difficult.
Gracias.
Eso está bueno. Y al tener todos licencia y estar al día, yo sé que eso ayuda en cuanto a propagaciones, a uno trabajar mejor y a poder ayudar a uno mismo.
Ok, mira, voy a seguir adelante, pero dame un segundo todos. Give me a second, everybody, because I have an emergency. I have to make a very important call to my father. I'll be right back.
¿Quién le pregunta a Michael Armano cómo vamos a conseguir la licencia? Si mañana, cuando vayamos al City Hall, ¿dónde vamos a ir a requerirla? ¿Quién le pregunta? Porque él habla inglés.
So go ahead. I'll let you. Go ahead, Liz.
So, ustedes van a buscar a mí y van a tener que asegurar que ustedes hicieron todo el pago. Recuérdase que ustedes, algunas debían un par de dinero que les faltaban de la aplicación. Pero yo le hablo con ustedes mañana cuando vengan, porque tienen que pagar eso antes que yo le doy la licencia.
Y lo que pagamos el bill completo de la licencia.
Yo se lo doy ahí mismo.
Lisa,
Okay.
Rosario, yo me encuentro en Puerto Rico, voy a estar hasta julio acá. Yo tengo todo pago y todo entregado. Puedo cuando regrese paso y me la tienes ready, ¿verdad?
Sí. Cuando regrese yo te lo puedo dar.
¿En qué piso estás, Lisa?
Yo estoy en el segundo piso, en el 207.
En el 207.
207.
Ok, gracias.
Are there any other questions we can clarify while we're on the high? ¿Hay otras preguntas que quieren saber de asunto de microblading que te puedo ayudar?
Yo estoy bien.
Hi, it's Mike LaFrance from Inspectional Services.
Hello, how are you doing?
Hey, not bad, yourself. I usually go
Very
out with the state inspector for the barber shops, and one thing we note is make sure they have that license with them at all times, even a copy of it, because she wants to see that each person has their license with them. So they should make a copy of it and keep it on them, like in a pocketbook or even in the case they use.
Do you want to do that, Liz?
They have to have it up. They can't put it up. They have to have it up shown.
They're going to post it.
Okay,
They have
good.
to post it on the wall.
So they don't, Mike. They don't travel. They're going to be based out of an establishment. They're not traveling.
Okay.
They're not going to somebody's house or
No,
different
it's
businesses.
and
Yeah, good. Okay.
Would you like to translate that, Liz, or should I like?
you should.
El inspector estaba diciendo que es muy importante que usted tiene su licencia en la pared, porque ellos van a ver si cada persona que está haciendo el proceso tiene sus licencias correcto para la ciudad. So, es muy importante y te estamos diciendo de nuevo que es importante que usted ponga la licencia que la ciudad te da en la pared para estar seguro que están cubriendo o sacaron la licencia de la ciudad. Para no dar multas y otras cosas, por favor.
Okay.
Estoy aquí.
Congratulations.
Okay. Okay, you all there still?
Yes.
Okay, bien. My father was having a little medical emergency. Sorry. Okay, let's move on. All right, I'd like to move on to COVID-19. Is everybody still with us? Jacqueline, Caesar, Mike?
Yes, I'm here.
Yep.
Okay.
Thank you.
Okay, good. All right. So we've entered a new phase in the COVID-19 pandemic. We've had since the initiation of our vaccination program in Lawrence. Right now, I'd like to proudly announce that we only have one ICU patient at the Lawrence General Hospital. This is an 80% drop in
Sorry, if you can say that again, Dr. Gone, I had to mute one of the.
Okay. We've had an 80% drop in the critical cases of COVID-19 in the city of Lawrence. However, this does not tell the whole story by any means. If we look at vaccination rates in the comparing Lawrence with the state of Massachusetts, we are way behind. We are way behind. Right now in the state of Massachusetts, approximately 53 to 54% of Massachusetts residents have received at least one dose of COVID-19 vaccine. Is that correct, Mike, more or less?
Yeah, it's up to exactly the most updated number is 56.1 in Mass has received.
Lawrence, unfortunately, is around 36%. Is that correct? Has received at least one dose.
Updated number is 37.2.
Okay. You know, the Hispanic population in the city of Lawrence has the number of Latinos that have received one dose is quite low. What is that number? That's like
14.2 right now.
So, I mean, as a public health official, living in the city of Lawrence, caring for the residents of the city of Lawrence, seeing the devastation that COVID-19 has brought to families through illness, unemployment, death, I just have a hard time understanding why only 13 or 14% of the Latino population of Lawrence has received only one dose of COVID vaccine. We have such amazing access to vaccination. No appointment is necessary. We have a walk-in access at 2 vaccination sites in the city of Lawrence. And we still have not been able to surpass 14%. The amount of misinformation, of social memes, of social media disinformation is so astounding that throughout my day in my office practice, I hear the most unbelievable fears being voiced by my patients as to why they don't want to get vaccinated. And I continue to have an incredibly difficult time understanding why, after people who have even lost family members in their own and their own immediate families are still reluctant to get vaccinated. Let me just be clear to the public. Over 300 million people in the United States have received one of these 3 vaccines. They have been proven to be safe. They have proven to be effective. And if people are waiting to see, I think we can say confidently that at this point in time, we have 3 excellent vaccine candidates that we can offer people. If they have reservations about a messenger RNA vaccine, which are the Pfizer and Moderna vaccines, which I still don't understand their reservations because they're incredibly effective, incredibly safe vaccines, they can go and get the Johnson & Johnson vaccine. If their fear about the Johnson & Johnson vaccine was the short period which it was held due to concerns regarding coagulation disorders, that has been completely unfounded, and we are now, and the CDC is recommending that people proceed with one of the 3 vaccines. The benefits of these 3 vaccines far outweighs the remote and small risk that one would face with getting vaccinated from COVID-19. So please, we as the Board of Health for the City of Lawrence urge our public, our families, to encourage their friends and loved ones to go to one of our vaccination sites to receive a COVID vaccine as soon as possible. We want to open up our businesses and our establishments. We would love to see more people outside without masks, but this cannot happen until we see a higher vaccination rate. It is essential that people leave these fears behind and they get vaccinated as soon as possible. The only good news I see within this community regarding vaccination is that of the 75 plus population, probably 82 to 83% of them have received at least 1 dose. What's the updated number, Mike?
The updated numbers is 81% of 75 plus, 83.3% of 65 plus, and actually not a bad figure, 70% of 50 to 64-year-olds.
And that's great for our most vulnerable population. However, you have to understand vaccines are approved for 12 and up. And it's the young people that are spreading, that continue to spread this pandemic. And we are worried about the variants that have been identified in all 50 states. We know that these vaccinations protect you from the variants that we are most concerned about. Having had COVID-19 will not protect you from the variants that we have identified, both the B117 and the P1 variants. So we urge all members of the public age 12 and over that do not have a contraindication to receive their vaccine as soon as possible. There is no obstacle to receiving this vaccine. This vaccine is safe, it's available, and if you want to protect yourself and your family, we urge you to get vaccinated as soon as possible. Let me just tell you a few more pieces of data. On average, only 3% of Lawrence are vaccinated each week based on the last 8 weeks. We need to do better than this. We have the capacity, we have the vaccines, we have the staff and the facilities to vaccinate a lot more people. So please, we urge you to get vaccinated as soon as possible. If we compare our vaccination rates to Boxford, Andover, Reading, Tewksbury, we are 20 to 30 points behind. It is an embarrassment, and I urge people to get vaccinated. Please, it is so essential that we get vaccinated and we get rid of this pandemic so we can move on with our lives. I urge public health officials, nurses, community development people, people working in social work, family members that have been vaccinated. Please urge your loved ones to be vaccinated as soon as possible. Some more information. The current state of affairs in the state of Massachusetts is that currently we're in phase 4, step 2. Is that correct, Mike Armano?
Phase 4, step 2, I believe. Yep. That's right.
Okay, so because cases have dropped in the state by 45% and hospitalizations have dropped by 23% and deaths have dropped by 69%, seeing all these metrics that we've seen drop since the beginning of the year, while the Commonwealth of Massachusetts remains a national leader in COVID-19 vaccinations, Lawrence is way behind. Way behind. So while the state, effective on the 10th, which was yesterday, is opening certain outdoor phase 4 industries, such as amusement parks, theme parks, outdoor water parks, that will be allowed to operate at 50% capacity, Lawrence really, as far as I can see, is on a slippery slope by following the state guidelines with those low vaccination rates. And I urge people to do better so we can open up our bars, restaurants, nightclubs, have events at our outdoor stadiums, our ballparks, start our youth and adult amateur sports tournaments, performances. It is so important that people get with the program and get immunized against COVID-19. You know, the only way that we're going to be able to move forward towards having parades, street festivals, agricultural festivals, have bars, beer gardens, breweries, wineries, distilleries, and restaurants with a 90 to 100% capacity is if more people in this town get vaccinated. It is the only way. So there you have it. I urge everyone to get vaccinated. It is absolutely essential for us to move forward with this pandemic. And that's all I have to say today. Is there anything anyone would like to add?
I agree.
I agree. And
Thank
I
you
just
very
want to
much.
say it in
Thank you very
Spanish,
much,
please.
Dr. Gordon, for that dictation of what's going on in the city. I agree. Thank you for being the leader. Thank you, Mike Amano, for orchestrating all the stuff that we've done in the city. We are blessed to have you both. Thank you.
Jacqueline?
Yes, Dr. Gordon. Thank you so much for saying all of that in English. Can I just say a little piece in Spanish?
Please.
Residentes de Lawrence, hemos creado varias clínicas en diferentes lugares y estamos ahí de 9 a 5, especialmente en la escuela de Arlington Middle School en 150 de la Arlington Street en Lawrence. Lleguen a vacunarse, por favor, lleguen a vacunarse. Estamos ahí esperándolos. De cualquier vacuna que tengan, hay 3 vacunas y las 3 las tenemos disponibles. Si no necesitan cita, no necesitan documentos, no necesitan identificación si no la tienen. Por favor, estamos esperándolos, es muy importante. Gracias.
Repite, Jackie, por favor, ¿dónde es?
Estamos en el Arlington Middle School, en la 150 de la Arlington Street en Lawrence. Se entra por detrás sin cita, no necesita nada necesita. Si no tiene documento, está bien. Si no tenga miedo de migración, no tenga miedo de nada. Estamos para servirles.
Hi, everyone. I just also want to mention that we are also, one of the nurses. We're also doing pop-up clinics around the city with different businesses. Tomorrow, we will be at Jacqueline's Chicken on 200 Salem Street in South Broadway from 9 to 5.
Excelente.
Dr. Gordon, if I may, thank you, Jamie Severino and Jackie Aguilar. I just want to make sure that some of what Jackie said in Spanish gets translated in English. So we do have walk-in clinics at the Arlington School. You don't need any documentation. You don't need an appointment. It's 9 to 5. You can come get vaccinated Monday through Saturday at the Arlington School. We actually have some openings, walk-in at City Hall from 9 o'clock till 4:30. And as Jamie just pointed out, tomorrow she's at Jackie's Chicken. I want to highlight that we started a program where we're trying to essentially have a business or organization host a clinic every day. So our goal is to have one every day, Monday through Saturday. Jamie's done a nice job of booking this up through at least, I think we're past the May 22nd now. And we've had great success at past 2 establishments. We've done 50 vaccinations at Mama Juana Restaurant. And today, I believe we're at Tripoli Bakery. And we did another 50 over there. We were also at, actually, Jamie's father has a mechanic shop. I can't remember the name of it, on Jackson Street. And we were able to vaccinate 50 over there on a Saturday. So we're going to continue this momentum and dig hard and get into the community. And if it's 50 here and 100 there, that's where we want to be. But we want to make vaccines accessible for everyone. If anybody has questions about the sites or where we're located, they can call 978-620-3330. That's our call center. Again, 978-620-3330. And we're going to keep pushing hard to get vaccinations to the community. Thanks, Dr. Gordon.
Excellent. Okay. So is the city of Lawrence for reopening, are we going to be following the state guidelines? Is that what has been decided?
We're still watching medical data every day, watching medical data every day and vaccination data every day. And we haven't made any decisions to veer from that. Obviously, we'll be in contact with you, Dr. Gorn, and talk more about that and see where the vaccination rates go. But to your point, I think if we can get vaccinated, we're all hopeful that we can open up the city again. But without the help of all the community, it's not easy to make a decision to move forward. As you said, it's a very slippery slope. So we're hoping people will get vaccinated.
Okay, excellent, excellent. Okay, Caesar, let's move on to tobacco control. Is there anything new to report? I know it's hard to do compliance checks during a pandemic, but is there anything in terms of education or moving in that direction? I think we might have lost Caesar. All right. So I think, is everybody still here with us?
Yeah.
Oh, I'm muted.
Yes, sir.
We did lose people though, Dr. Gorn.
Okay, that's all right. Okay, the tabled matters we're not going to address today. We have heard from Caesar and our city nurse, Jackie Aguilar from Stephen Hill. I want to thank you all for coming, and I want to wish all our microbladers luck in their future. And do I have a motion on the floor to adjourn the Lawrence Board of Health meeting?
Can I make a motion to adjourn the meeting it's today the 11th, on May 11th, 2021? It's the
Excellent.
11th, or a motion to adjourn the meeting?
Okay.
The Board of Health meeting.
Wonderful. We will set a date for the next Board of Health meeting in the near future. Would most likely will be in the middle of June, but we will confirm. We will set an agenda. And thank you all for attending, and stay safe, and we'll see you soon.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you.
Buenas suerte en sus negocios.
Okay,
This
thank you.
conference is no longer being recorded.
Bye-bye.
Bye-bye.
Bye.